So welcome everybody. My name is Dr. Koru. I'm an associate professor in the Department of Information Systems at UMBC. Today I'm going to talk about the program and our courses. So let's get started with the first slide. So this is the agenda. I'll give some information about UMBC. I'll introduce myself, and I'll talk about the faculty associated with the program. We'll talk about why study health IT, because you will be investing your time and effort, or you're thinking about doing so. We'll talk about the opportunities and why health IT at UMBC. We'll talk about some of the degree requirements, and then the UMBC graduate school policies and the application process. So if you have any questions, feel free to post them or take notes. So we are going to be answering the questions at the end. So UMBC is one of the universities in the University System of Maryland. It is known as an honors university. So we attract motivated students, and we provide all the resources and attention that they need to succeed here. We always encourage interaction between faculty and students because it really strengthens both teaching and research. Our classrooms are always active. We pose questions. We follow active learning participation principles. We often have group work. So this requires some more preparation maybe, but more engagement on both sides. Faculty and students make the classroom more fun, and it results in a better learning experience for everybody. So we are one of the most diverse universities in the US, so this is something we are proud of. It always brings us fresh, new perspectives. And we are also recognized for our research and technology programs. We do a lot of good, high-quality teaching, but there is a lot of research activity going on here at UMBC. We get funding from federal agencies to do research in several areas. Health information technology research is one of them. And the US News and World Report consistently ranked UMBC as an up-and-coming university for 5 consecutive years. And this is a title given to the universities who make the most promising and innovative changes in the areas of academics, faculty, and student life. And UMBC has been named the top national university for the promising and innovative changes. So this is some information about my background. I'm the interim program director. I'm an associate professor of information systems. So this particular program is closely linked to the Department of Information Systems at UMBC. The faculty members, including myself, put a lot of attention and gave direct feedback in the formation of this program. And we are going to be keeping a close eye as this program evolves and make sure that our students get the best we can provide as a university. And we are going to pay attention that this is a quality program as we make progress. I have a PhD in computer science and MS in software engineering, and another MS in computer engineering, and undergraduate degree in computer engineering. So the reason why I put this is that, as you can see, I come from an engineering and then kind of science background. But since 2006, I started to be interested in health area, perhaps because of being in the Baltimore-Washington region, where we have a lot of providers, hospitals, and government agencies who are very interested in healthcare. So then my teaching and research started to go in that direction, and currently I'm heavily involved in health information technology research. I'm a member of AMIA, American Medical Informatics Association, and I also serve in the policy board for Health Information Exchange, organized by the state of Maryland's Maryland Healthcare Commission. So my specific research interests, and if anybody is interested, you are always you're welcome to contact me. I focus on home health care and hospice, how to use health IT in those environments for quality and process improvement. I'm very interested in health data, how to use health data to provide analytics and support for decision makers. I did some work in privacy and security, particularly about how to de-identify health data sets for public use. I did some work with user interface design for health IT, and also I have software engineering background. So our faculty in the department and also in this program, we have instructors prominent in the health IT industry, academia, and government fields. We pick our instructors very carefully. So the information systems department members, faculty members are very much involved with this program, particularly maybe because we also do research in this area. So we have a stake, because if this program provides a better preparation for the health IT professionals in this area, this is something definitely that's something that's going to contribute to the department and university from research perspective as well. So we conduct cutting-edge research. So of course, definitely this is not the only health IT research conducted at UMBC, but you can visit my website, our lab's website at hit.umbc.edu. So I had real-world experience in industry and research. So let me start by talking about why health IT. I think this plot tells us a lot. So on the y-axis on the left side, you can see the trillions of 2009 dollars. So according to the projection at that time, the healthcare costs were expected to jump from 2.5 trillion to 4 trillion. So remember that 1 billion is 1,000 million and 1 trillion is 1,000 billion dollars. So this is a significant increase. So what the Recovery Act did is they tried to reduce this. So they passed the Affordable Care Act, and in the health IT landscape, we talk about HITECH Act, which provided incentives to the hospitals and physicians to adopt electronic health records, with the hope that in the long run we can at least reduce these costs and bring them from 4 trillion to something like 3.5 trillion. So in addition to a lot of expectations on the health side and quality of care side, there's definitely an interest in reducing the healthcare costs, because we cannot continue like this. So in this slide, some of the bullets talk about what I mentioned by looking at the graph actually. So there was this HITECH Act, and it stands for Health Information Technology for Economical and Clinical Health. And incentives through CMS, Centers for Medicare and Medicaid, were provided for electronic health records adoption. Now those checks are already sent, and then the organizations who receive the incentives, they are in a position to show their meaningful use of electronic health records. And also remember that this wasn't the only approach. Affordable Care Act brought many changes. Now we talk about better patient-centered continuum of care, value-based payments, and accountable care organizations. So all of these with technological innovations such as big data, mobile computing, cloud computing. If you think about the last decade, we experienced a lot of changes. So we all use mobile devices right now. We analyze very large data sets. We use social networking platforms. So all of these changes raise the expectations on health IT to meet the needs of this changing landscape. So I often talk with people with different backgrounds, and they seem to believe that health IT can easily respond to needs in any area. And they sometimes think about, Google provides many services, Facebook provides many services. So why should it be a big challenge to leverage information technology in health IT? So I call this Google or Facebook effect, but sometimes there is this optimism, but is it so straightforward? It's not always very straightforward, because this area requires solving or supporting complex workflows, which I'll discuss further. But I have this 3 slides where I want to talk about why health IT in Maryland, because I'm thinking that many of you, and attendance jumped to 21 right now, I can see, which is good. So why should you focus on health IT, particularly if you're in Maryland? So CMS recently approved Maryland's application for a revised Medicare payment system for a 5-year period beginning January 1st, 2014. So it's actually started. So according to this agreement, Maryland will limit its annual all-payer per capita total hospital cost growth to 3.58. So we are limiting the increase in the healthcare cost, and this ratio is actually the 10-year compound annual growth rate in per capita gross state product. So healthcare costs cannot increase more than this. So Maryland will shift from all of its hospital revenue over the 5-year performance period into global payment models. And you can read more about this innovative model by going to this website. The slides will be available to you as well. So what does this mean for health IT? So this means that increasing the volume and increasing revenue is not possible anymore for the hospitals. And hospitals must reduce readmissions. They must reduce the rate of hospital-acquired conditions. This is still a big problem for Maryland. And also manage population health better. They need to think about which areas they serve, what are the needs of the population in that area. And this requires a cultural shift, a new understanding and collaboration. And we need to create new partnerships in the state. So hospitals need to collaborate with community organizations, long-term and post-acute care organizations such as home health agencies and skilled nursing facilities in the state. So, so this means that clinical workflows, clinical decision-making, and public health will have to improve. So when we discharge patients, we need to think about what happens after the discharge. Where do we send them? If we are sending them home, who takes care of them? Can we transfer them to a home health agency so that they are not going to be readmitted to the hospital? So all of these changes enforced from the top is actually going to require a lot of quality and process improvement. And patient-centered continuum of care will be necessary. So I put this in caps. I usually don't like writing stuff in caps, but I would like to emphasize this. New and better health information systems, information technology, and information exchange will be needed in this state. So currently even in the same organization, we cannot achieve this easily. In many hospitals, patients can actually travel faster than their information because maybe the lab is not connected with the clinical side. So you as a health IT professional will enter the workforce at a very exciting time period for Maryland, and your contribution will be valued and rewarded. So if we make Maryland a successful model, other states may actually follow a similar approach. So, so health IT opportunities and challenges. I talked about the expectations from the politicians and some of the Google and Facebook effect that health IT should be easy to leverage. Information technology should be easy to leverage in healthcare, but it's not very straightforward because the workflows are complex. The data structures you need to use, they are complex. And also there are difficulties with demonstrating usefulness and ease of use because when you start to support real workflows, like for example we had at the beginning of this presentation, right? Things should just work smoothly and it should be easy to use and people should see the value clearly. So how to make the systems easy to use, it's a big challenge when you think about healthcare workflows. Requires us to think about human factors, and also people should believe and sometimes perceptions and beliefs are also very important in addition to the reality that the system will basically provide relative advantage to the individuals as opposed to those who don't use the system, and relative advantage to the organization. So that way the adoption rate is going to increase. And also think about the continuous stream of changes and managing them. One example is a transition from ICD-9 to ICD-10. As you know, a more detailed the disease code set is available now, ICD-10, and the rest of the world already made a transition, but the United States keep postponing this deadline. And the reason is that everybody already adopted these electronic health records with the incentives recently made available. Now those systems need to change. And I was just yesterday talking with one of our provider partners and about how the workflows need to change because of this, and their vendor changed some of the workflows because they want to go through to a more automated approach in admitting patients and decision making, because ICD-10 is a very detailed system. So those changes now require the organization to change their workflows and retrain their patients. So even retrain their staff. So even these training aspects are very important. We need to think about that. And there are high stakes and lack of agreement among stakeholders. So unfortunately, health area had very big organizations as stakeholders, which are not always in an agreement about how they should operate together. So if you look at health information exchange, in its essence, it's actually a non-technical problem. So in the health information exchange course in this program, we are going to be talking various aspects of health information exchange, including its technical aspects, organizational aspects. So these are some of the reasons why information technology is not very straightforward to leverage in the healthcare area. And the successful health IT adoption relies on various aspects. We need to consider the people aspects, organization aspects, technology, and also environment. As the law changes, there are new systems, both computer systems, network systems, and also other environmental variables. We need to adapt to this change. Sometimes people think that health IT is a difficult problem to solve. So once we adopt the system and use it, we are done with it. But actually, they need to evolve and keep up with the future changes as well. So it comes with a cost, and we need to always justify the benefit of using health IT. So Health IT MPS degree is designed to build up knowledge in our students in all of the above aspects. So the program was designed very carefully, and we pick very talented and knowledgeable instructors to teach our programs, so our courses. So the job opportunities, as I said, the number of health IT job postings are increasing because of the recent incentives in electronic health records, and our marketing research before starting this program also validated this. So health IT implementation in healthcare is one of the area where you can find jobs, which means that you have a big software system, let's say Epic, or let's say a system produced by one of the vendors, McKesson. I'm just giving examples, and then you take the system and implement it in an organization. So this is a complex task, because even though the system is very customizable, how to customize it, how to make it useful to the organization is not very straightforward. And sometimes I heard that customization can be more difficult in certain cases than actually developing their own software. But this is the path that many health organizations have to take, because they cannot afford developing software from scratch. So health IT development could be another area, and there are organizations who develop applications. So this is closer to the software development area, where some knowledge of healthcare will be necessary. So there are vendors who constantly develop solutions for clinical settings, ambulatory care, home and hospice. And also on the consumer side, you'll find many apps produced and posted day by day. Their numbers are increasing for healthcare and wellness. So based on my earlier research in software engineering and project management, I can tell you that one of the biggest risk factors for software failures is actually not understanding the requirements and not being able to understand the different expectations of stakeholders. So even if you go to an organization which develops software, your background that you obtain from this program will allow you to understand, interpret requirements better, write your code better, and eventually finish your products within time and budget, which is very much valued and appreciated in the development settings. There are companies developing medical devices, as we have smaller and smaller medical devices. Some of them can be even wearable or can be implantable. So business process intelligence, it's growing right now. As we have all this data, we need to leverage it, and we try to use it for better decision making, better quality improvement and process improvement. So in the insurance sector, in the public health area, in governments, there are right now many individuals who keep analyzing data sets for better decisions. If you have a legal background, this program can help you to go into the legal sector and deal with health IT laws and regulations. Local, state, and federal governments, because of my continuous conversations with the colleagues in MHCC, I know that, for example, Maryland is very much involved with the developments in health IT. So they keep, posting some job positions. That could be an option. And also, if you have entrepreneurial spirit, that's the program gives you a good idea about the landscape and which areas can be more fruitful to proceed. So these are some of the areas that you can go for your future job. So why health IT at UMBC? UMBC is uniquely positioned to provide education and training in this area. We have, for example, the information systems department, which is very interdisciplinary. So we are not only involved with the technical aspects. So we are very strong in the technical aspects of IT, but we also pay a lot of attention to people and organizational aspects of IT, and we already do research in the health IT area. And employers in this Baltimore, DC, Northern VA region exhibit greater growth in health informatics and health IT positions than the other employers nationally, and it's simply because we have many big organizations in this area, including several NIH institutes, AHRQ, CMS, other governments, many companies. So, for example, Northrop Grumman is one of them. So the region experienced a 44% increase in the total number of positions in health IT positions from 2007 to 2012. And our department here at UMBC has a very long tradition, history, and success in health IT. Actually, before the nursing informatics program started in downtown, they used to send their nurses to take some of our information technology courses. And some of our senior faculty members, such as Tony Norcio and Roy Rada, had always collaborations with nursing schools. Sometimes we, or the social work department or the medical school in downtown. So we frequently serve in their PhD committees, and their faculty members come and serve for our students' PhD committees, and we work in several projects together. So this degree is aimed at current professionals and not necessarily entry-level recent graduates or career changers. So the mission is empowering professionals to leverage information technology for quality healthcare. So as quality increases, the costs are expected to drop, and quality always also comes as a requirement. So the recent Maryland initiatives that I mentioned at the beginning come with not only restricting or decreasing the costs, but also with some quality expectations. So the healthcare organizations should also show that their quality of care does not drop as the healthcare costs are limited. So you may have existing IT or healthcare experience, and typically the students who come to the professional master of professional degree programs, they have some kind of leadership or supervisory or managerial aspirations. So you want to get to a better place in your career where you play more leadership, more supervisory or managerial roles. And the program takes an interdisciplinary approach encompassing both disciplines, and soft skill development necessary to function effectively in the workplace. But you must be willing to learn in different areas, because it is quite possible that you will feel stronger in some courses or not so prepared in other courses. But I'd like everyone to understand that this is very normal and expected. So you should have the willingness and ability to learn in different areas. So this does not require a formal master's thesis, and currently the program is for on-campus. So you will be coming to the classroom here, and actually it's a good thing, because you can see our instructors, and it's a very live and engaging discussion. You can ask questions, and our courses will also have some online components as a supplement. So MPS Health IT for whom? So these could be healthcare professionals, nurses, social workers, physicians, computer science professionals who have strong technical skills but may not know about health administration, health services, health policy, information systems professionals, or other experienced professionals in the health IT field, could be from private or public sector. So we have 6 required core courses in the program. So these are Health Informatics 1, Health Informatics 2, which will give you a very good coverage of this area. And then we move on to Health IT Law and Ethics, which talk about what is right or wrong from the societal perspective, and also legal regulations and laws play a huge role in this area, such as HIPAA, privacy laws, which were revised recently. So the course will cover those aspects. Health IT policy and administration is another core course. And health data analytics, the use of data is important. So health data analytics will give you the ability to make sense of data, analyze it, and draw better conclusions. And we have a capstone project which will require you to learn to apply what you learned in this program in a semester-long project with other team members. So in addition to core courses, we would like students to choose from a set of courses depending on their interests. For example, maybe you are more interested in implementation, you can take the implementation course, or you are interested in becoming the privacy officer of the hospital you work in, so you want to go more in the health information privacy and security area. So these are our elective courses. So we are going to be offering them to accommodate different needs of our students. So some of the important policies and designations. So from the university perspective, you are a full-time student if you enroll for 9 credits. You are not a full-time student, you are a part-time student if you are enrolled for from 1 to 8 credits. So continuous registration means that required, so you will be enrolled every semester in the academic year, fall and spring. But leave of absence is allowed. Basically, you talk with the advisor, with your advisor, and then so this would be the graduate program director, and with the approval, you can have leave of absence. The academic standards. The graduate school has the requires you to maintain a minimum cumulative GPA of 3.0 during the course of the study. So I think this is a good threshold to keep in mind. We would like to have a good, high-quality program, and GPAs and your grades will be important. So transfer credits, UMBC's graduate school will allow a maximum of 6 graduate credits, and the consent of the program director is required. So if you took a look at the courses, if you think that you took similar courses in other institutions, after you get accepted to the program or before you get accepted, we can discuss and see if they can be counted towards your degree. So we require an undergraduate degree. This could be in information systems, computer engineering, computer science, health education, or a degree related to healthcare professional practice or healthcare management. But it's important to know that these are not the only undergraduate degree types. For example, in my career, I've seen people who graduated from a math program, but they become excellent software developers. And maybe you graduated from another field, but then you took a job in the IT area. So please contact us if you have any questions related to that. So we would be happy to give you more information about whether your degree will be related to the program. So statement of purpose is necessary because I'd like to hear what you want to do with this degree. Of course, I give you our reasons for offering this, but there are personal reasons why you want to pursue this. So I think going through those and then writing a good statement of purpose is useful for you. It's useful for us so that we can understand the intentions of our students. So I already mentioned minimum undergraduate GPA. No, this is different. The previous one was your ongoing GPA. So for the admission, a minimum undergraduate GPA of 3.0 on a 4 scale will be necessary. And for the international students, I don't know whether we have any in the attendance, but basically we'll require TOEFL and GRE. But if I am not wrong, for the international students who already graduated from another program in the US, we may not need TOEFL. So please feel free to contact us if you have any questions about the admissions. So how to apply? So you can visit the UMBC Graduate School website and complete and submit the application. So there is a fee, and if it's higher, if it's paper application, because somebody has to enter your data, and it's less for online applications. And you can definitely submit letters of recommendation, so I'll be reading everything, including those letters of recommendation. It could come from your previous professors or from your boss. If there are letters who say good things about you, that's definitely going to be a plus. The application process, as you may know, already started, so we have already received applications, but the deadline is August 1st, 2014. So for more information, you can always contact Renee too, so you can see her email address here. So thank you very much for participating. I think this is the end of the slide. So we will also, I encourage you to fill the survey or if there's any evaluation form after this presentation. With that one, I would like to ask you if you have any questions.
Hi, Dr. Koro. This is Denise Cardona again. We did get several questions that came in. So what I'll do is I'll ask those to you right now. One of them is there any GPA waiver? I've been out of school for 10 years. Is there conditional admissions?
So I'll let Renee to answer this because I'm a new graduate program director, so Renee is more experienced to answer this. Do we
Okay, Renee.
Monitoring period or?
Hello. While there is no official waiver, the program will review everything you require, everything that we require. So you can still apply. Also, if you have taken other graduate level courses, maybe not received the degree, you can send those transcripts as well. So we will review everything, and if we see a strong candidate, we will make a recommendation to the graduate school.
Thank you, Renee. I appreciate that. Another question came in. GRE isn't required for non-international students, but if we've taken it, will it weigh into the admission process?
So you mean TOEFL is not required or GRE? Because we require GRE typically from from all students, but Renee, do you have any thing to say about it?
So For non-international students, the GRE is not a requirement. If you submit it, it will be reviewed. But it is a requirement for the international applicants without a U.S. institutional degree.
Very good. Thank you. Another question, what is the time schedule for the classes? Since I am a full-time employee, I would like to know if I can accommodate my work with it.
Yeah, so these will be evening courses, typically starting at either 4:30 or 7:10. So if it starts at 4:30, it will go from 4:30 to 7. If it starts at 7:10, then it will go from 7:10 to 9:40. So it is designed to accommodate the professional working students. But of course, you need to make your own accommodations too. This includes, taking the commuting time into account or leaving the work a little bit early that day. So yeah, that will be necessary.
Fantastic. Thank you. We have one more question here. What is the time frame for completing the HIT degree?
So again, depends on how fast you go. So you can take 3 courses a semester and become a full-time student, and we have 30 credit requirements. So this means that you can finish in 2 years, or you can take maybe 1 or 2 courses, in which case it is going to take longer. But I would also encourage you to think realistically. So it is not a bad idea to take 1 or 2 courses if you have heavy workload. And you can adjust it based on the semester too, because based on my experience, the success or failure at the graduate level is strongly tied to not being able to balance different responsibilities in life. So many of our students are working professional students. They have family responsibilities, job responsibilities. So if you have any questions about how much you can accommodate, feel free to ask us. Yeah, depending on how many courses you take per semester, you can finish in 1.5 years, 2 years, or it can take longer.
Great, thank you. Another question just came in. Will this department have any open houses where admission determination is done on site?
I don't think, no, we won't have that.
Okay.
Because this is a process where we need to pay attention to each application and go through the application materials carefully, and also we need to pay attention to the baseline too, which will be determined based on the application. So we don't do this in this program.
Okay, thank you very much.
Examine your application and then we'll review and let you know.
Okay. Does this degree require any kind of certification after completion of degree for job search?
No, I don't think so, because actually remember that this is a master's program, so the courses will prepare you to play leadership role in the health IT area. So if you think that you have to finish certifications about specific EHR or database or coding systems, feel free to do that. But I think the real benefits of this program is you're going to be able to help organizations to leverage health IT systems. So more technical, very detailed skills that can be obtained through certification programs can be helpful, but I think this degree, by its nature, it holds a higher position compared to certification degrees. For example, right now, if somebody has a PhD degree, nobody usually asks about the undergraduate or master's degree, because PhD degree is the terminating degree, the highest degree. So similar to that relationship, because certificates can be obtained in a shorter time frame. So this program and the degree comes with it has a higher position compared to those certificates.
Great, thank you so much. And we have one last question. Are health information technology programs accredited by any organizations in the general sense?
Yeah, so there are certain initiatives in the U.S. There is not a you know, general consensus about this. So we'll keep a close eye on that. And currently, our information systems programs at UMBC, which offer undergraduate, masters, or PhD, are not going through any accreditation, whereas some other areas in the engineering may go. So this depends on the field and depends on the particular institution and their view about the field as well. So we need to keep a close eye on the developments in this area, and I will make adjustments as we go on.
Great. And we had one last question come in, and then if any additional questions come in, you can type them in and we will get back to you. It says, I am a medical technologist and I don't have software experience. Do I have to take any extra classes to continue studying this course?
The program? No, because the programs, they don't involve programming or software development. If you think that you want to establish skills in those areas, definitely you are welcome to take those courses. Remember, here we are presenting the minimum degree requirements. But one advantage of being a student at UMBC is there's a variety of courses offered by many different programs. So, and also each student can take, I think, 1 or 2 courses from other programs. So if you are very interested in, you know, programming, or if you think that you need to learn about programmatical thinking and want to pursue, you can do that. But the current courses, they don't require programming.
Okay.
Health IT implementation is about taking a very big system and customizing it. Health data analytics may involve writing some scripts, which are small programs, but the main purpose is to analyze data, not to you know, write programs. And you can always take more courses, so you feel free to do that.
Great. Thank you so much, Dr. Koro. That concludes our question and answer section. Any questions that come in after this, we will email you back. We do have your email address, so please be on the lookout for that. Thank you, Dr.
Well, thank you everybody for attending. So we look forward to receiving your applications.